Hi, my name is Ryan and welcome to Miza Medical and Wellness Spa's official YouTube channel. Today we're going to discuss all things Botox, and if you're coming here from my TikTok video, well, let's just get right into it. I was born with a birth defect known as brachial nerve plexy. So from the very young age of 11, I needed to get Botox in my trapezius muscle on the left side because this was the most active muscle on my hand, and this muscle started to hurt a lot. Like everything I was doing was basically being done by this muscle. And so to help all the other muscles kind of kick in and share their weight of the burden, I had to have this muscle quieted down, if you will. With that said, you can start to see all of the ways in which Botox can be used. Now, it is famously known to be used for facial and aesthetic reasons, but when I first got it, it was definitely for medical and health reasons. Botox in itself was originally used for migraines. It was used to treat migraines. And then the doctors noticed and the patients noticed, every time I get Botox, my face is remarkably smooth. My skin is remarkably glowing. And like the lines and wrinkles that I had before I started getting the Botox for my migraines have gone away. So what is the tea here? The tea was that Botox also helps with the skin. Whenever you relax the muscles, you by default relax the skin. You shrink the size of the pores, you smooth out the skin, and your skin simply looks flawless. The best way to know when you should start getting Botox is by understanding how Botox works. I like to explain how any of these products work because I feel like that will help you make the right decision for yourself moving forward. Now, if you were a client of mine and coming to Miza, you got a consultation with me, we would have this conversation again before we even start the procedures. When Botox is injected in a particular part of the body, it works by inhibiting acetylcholine from communicating with the muscle fibers in that area and making the muscles move. Acetylcholine is a substance, a chemical, if you will, that is secreted by the nerve endings to provoke the muscles to move, okay? So for the sake of this conversation, let's call acetylcholine Ashley, okay? So for example, I want to wave my hand, okay? There's a group of muscles responsible for me raising my hand and waving my hand. So when I want to wave my hand, my brain tells the nerve endings that are connected to these groups of muscles, hey, Ryan wants to wave her hand. The nerve endings tell the muscles, wave the hand for Ryan. Right? But how does the nerve ending communicate that with the muscles? It tells the muscles that by sending out this messenger called acetylcholine, aka Ashley, for the purpose of this video, of course. Now there's a receptor attached to all of your muscle fibers, okay? So when Ashley is sent from the nerve ending to communicate with the muscle, she goes to the receptor. Once the muscle receptor grabs onto the acetylcholine, it knows to move. And that is how the message gets from your brain all the way to your hand and waves. This is the same with every muscle around your body, and this happens in a split second. Like you are not even thinking about it. Unless you have some type of muscular defect like I had with my hand, you are not thinking too hard about your bodily movements, right? The same thing with the face. If I want to blink, if I want to frown, all of these are muscle movements that are being performed by the muscles in that area of my face. So when I frown too much, if I squint too much, I will eventually form lines on my skin, the skin that is covering the muscles that are doing those movements very often. Which is why for someone who has maybe had eye problems their whole life and has never really worn glasses, they will start to see crow's feet earlier than the average person because they've spent a lot of time squinting at things, and so the skin has started to wrinkle and ripple. So how does Botox work in this process? When Botox is injected into, say, my hand, for instance, it blocks the release of that acetylcholine, okay? So Botox basically is like a gatekeeper. It stops the acetylcholine from leaving the nerve and moving to the muscle and informing the muscle it is time to move. It stops the acetylcholine, right? So when you inject Botox, it actually stops that message from being transmitted to the muscle. It blocks the acetylcholine from talking to the muscle, thus stopping the muscle itself from moving or moving as much. Now, what are the side effects of Botox? If you inject way too much of it, you will lose all muscle movement in that area, right? Because when Botox blocks acetylcholine, it doesn't block all of it, it's selective. You know what I'm saying? So you put enough for it to block some of the acetylcholine and reduce the movement, which is why I can frown, but my frown is not as intense as it would have been had I not gotten Botox. Some of the acetylcholine is being blocked, and that is why my frown doesn't form those 11s on the glabella right here, or the frown lines, if you will. Now, if I got way too much Botox injected into my forehead, I will not be able to frown at all, and that is when you get these types of faces. We have all seen these types of faces.
You inject Madonna's face?
I cannot tell you what I do to her. She may just come for a little skin treatment and may...
The goal when it comes to getting Botox, fillers, or any of these procedures is you want to look refreshed. You want to look refreshed. And so if there is an issue that you're dealing with, you're facing as a result of muscle movement, then you can consider Botox, right? So if, like I said, you squint too much and you've started to see those lines there, you can consider Botox around those muscles to reduce your squinting. If you have a really aggressive smile, you can consider Botox to reduce the appearance of the smile lines. By understanding that Botox works on a muscular level, it will help you understand when is the right time for you to start getting Botox. The reason why most people get Botox when they're well advanced in age is simply because when you're advanced in age, your skin starts to lose its elasticity or its ability to bounce back into position. So when a little baby frowns, for instance, they don't form lines because their skin has an excess of hyaluronic acid, and so it just bounces right back into position. Versus when a woman in her 40s frowns, for instance, the skin has lost a lot of that hyaluronic acid, has lost a lot of its elasticity over the years. As such, her skin will stay in place or those lines will start to set in. This is why people start getting Botox as they are aging to compensate for the loss of skin elasticity. The most graceful work, in my opinion, is work that allows you to have facial expressions without completely freezing over your face and still allows you to look and feel natural in your facial expressions. So when my clients get Botox, when I get Botox, I want to be able to move my face. I still want to laugh. I want to smile. I want to frown. I want to go, huh? I want to raise my brow. Like, I still want these movements to happen and to happen so naturally that people who know me can't even tell that something has happened to my face. That, in my opinion, is the goal for really great work done. The issue, I have found that the issue usually is with people who want to look 20 years younger. Once that is the goal, we already have a problem, okay? Time is not a thing that I can simply reverse. No matter how good I am at what I do, people can tell when you have gotten too much work done. There is a certain youthfulness to like a 20-year-old or a 25-year-old or an 18-year-old that really can never be replicated on a surgical table or by injections. It is an essence to the skin, right? A certain look, a certain glow. It just cannot be replicated. And the more you try, the more alien you start to look. The goal is to look refreshed in your age at your level of maturity. So I should not be aiming to look like an 18-year-old. I am 30. 18 was 12 years ago for me. That is 12 years of gravity, of sunshine, of movement, of life activities, illnesses, whatever you name it. I have been through 12 years of stuff that has gotten my face to this point. So will I simply be able to reverse that by getting some Botox and filler? No, that is an unrealistic expectation. And whenever you set yourself unrealistic expectations like that, you end up with results that look so alien. People start to notice, ooh, she's gotten a lot of Botox. You know what I'm saying? However, you do have results like, dare I say, mine, okay, where I am my age. I believe I look my age. I don't think I look significantly younger than my age, but I definitely have a refreshed look. I have a glow to my skin, right? I have a certain youthfulness, a certain je ne sais quoi to my skin that is the effect of a nice, decent amount of Botox done regularly. Now, we have seen all these types of faces, so many videos, so many episodes of Botched where people are like straight up just addicted to Botox. You know what I'm saying? And like, I start to think that there are people who struggle a lot with body dysmorphia and are not even aware of it, okay? Because if you're insistent that looking like, you know, a doll from Madame Tussauds little gallery is proof of youth, then you have lost completely the plot. You have lost the plot. The goal is not to look like a wax doll. The goal is to look like a refreshed version of yourself. Now, the truth is, one of the signs of aging on the face is lines and wrinkles. That is one of the telltale signs of aging on the face. And this is why you can have somebody who is as young as like 25. If they have certain lines or wrinkles on their face, it can be as a result of certain facial movements. Remember the squinting I was talking about? If you've always had problems with your vision and never really gotten anything to correct that, and you've spent a majority of your life squinting, no matter how young you are when that started, when you get to your 20s, you can start to see those lines forming. And because lines and wrinkles are one of the telltale signs of aging, you might start to look older than you actually are because you have lines and wrinkles forming. So does that mean every 25-year-old should start getting Botox? No. Does that mean everyone should only get Botox at the age of 40? No. When you start getting Botox, it's entirely up to you. What I need you to understand fundamentally is what Botox is going to do for you. How does it work and what will it do for you? Now that we understand exactly how Botox works, and we understand that by the mechanism of how Botox works, it will help smooth out those lines and wrinkles, you can start to use that information to look at your own face and assess yourself. Is this something that requires Botox right now? The next thing you want to think about is this something that if I start getting Botox for right now, I can keep up with the treatments? Because yes, upkeep is very important. I have a whole video on TikTok about my full facial transformation, what I used to look like versus what I look like now. And those were what I would call for myself very extreme changes, okay? But my upkeep is not as extreme as those initial procedures. I will make a whole nother video on the upkeep of my face. And so if you're interested in that, just click on our channel. In conclusion, Botox works on the muscles, okay? It doesn't work on your skin, it works on the muscles. But by relaxing the muscles, by reducing movement in the muscles, it reduces movement in your skin. Your skin does not move itself. It is the muscles attached to your skin that move your skin. So if the muscles are relaxed and moving less, the skin will move less. By default, there will be fewer lines and wrinkles on the skin. Also, by default of less movement, of less activity inside their skin, the pores will start to shrink. So you see a lot of times we would use Botox in microneedling procedures, okay, because we want to help shrink those pores and reduce the production of oils and sweat in your skin. Another great use for Botox is hyperhidrosis or excessive sweating. We can inject Botox directly into your underarm or other parts of your body where you sweat excessively. I have patients that I do baby Botox around their cheeks and their nose and their chin and the top of their lip so that they don't sweat excessively. We are based in Texas, so it gets really hot here and people are sweating through their makeup, and to prevent that, we inject Botox. Botox is such a versatile liquid, so if you have any more questions on this subject, feel free to drop them in the comments below. Please subscribe to the channel, like this video, share this video with anyone who is interested. Again, my name is Ryan. I'm a certified nurse injector and the owner of Miza Medical and Wellness Spa. We are located in Dallas, Texas. If you would like to book a consultation with me, it can be virtual or in person. Just click the link attached here and book that consultation. I want to have these conversations with you one-on-one to better help you understand what will be the best solution for you. But I hope this video overall was helpful in understanding all the ways in which Botox works. Again, if you have any questions for me, be it Botox, filler, microneedling, even plastic surgery related questions, drop them in the comments below and I will be so glad to answer them with nice, long, detailed videos and examples for you guys. Thank you so much for watching. Please subscribe to our channel, share this with anyone who you think will be interested, and I will see you next time. If you are an RN or nurse practitioner interested in getting into cosmetic injectables and want to be mentored, feel free to reach out to me. You can send us a DM on any one of our social media pages or send an email to info@mizawellness.com. Again, that's an email to info@mizawellness.com, and simply let us know you are interested in one-on-one mentorship to become a cosmetic injectable nurse.